All right, Dr. Steph here, and right now we're going to get into the symptoms of parasites. When we go through the symptoms, I want you to also think with various common named chronic diseases that might also be presenting that way. And the reason why I say that is because we need to start going back in time where, 100 years ago, we knew that there were certain diseases or certain presentations that people would have that were very much associated with chronic infestations of parasites. We do not acknowledge this and we completely ignore it in our current medical system. More often than not, people are taking a lot of medication for very common diseases to handle the symptoms, and it's not handling the underlying cause. And a lot of the diseases we have today could have multiple causes, and parasites are a huge factor that we find in a lot of our patients. So what's interesting is that, aside from when we think about parasites, people think, let me back up. People think of really intense, bowel issues. Like if you went away to Jamaica and came back, or went to Mexico and got stuck in your hotel room with super severe diarrhea, you'd be immediately thinking you got a parasite. But they do not have to enter us and become an acute, alarming situation. In fact, more often than not, people are infested and have no recollection of when it might have happened. Or maybe they do, maybe they didn't feel so great when they were away. And after that, a little bit of an acute situation, they haven't quite been the same or something started to manifest later. Remember, parasites can live in us for decades. And we can have more than one type, especially, we live on the planet a relatively long time compared to other animals that are routinely known to have parasites. So many of the symptoms are similar to allergies. And the reason why is that a specific white blood cell is known to be triggered when we have parasites, and it's called an eosinophil. This is a type of white blood cell that releases histamine. So it creates a histamine allergy type reaction. It's generally not quite as severe as, for example, an anaphylactic shock reaction from eating peanuts, if you had a peanut allergy or something like that, or to a bee sting. But it will present, often what I see on blood work is a somewhat elevated, higher than normal eosinophil count on the white blood cells. So when we run blood work with our patients, we don't just run a CBC or a complete metabolic panel. We run a CBC with differential. So what we're doing is we're not running a complete blood count of red blood cells and white blood cells. We want to know the breakdown of the different types of white blood cells that someone has. And I'm specifically correlating someone's history with allergy type symptoms that we'll go through here, possibly some travel or exposure or some known kind of incident, with if they have slightly elevated eosinophils. So generally, the white blood cell counts are just differentiated by percentage. So you've got all these different types of white blood cells, and you'll see a percent of what the ratio is. And if eosinophils are 3 or are slightly over 3% or a single digit elevated over 3%, that's a flag for me for possible parasites. If someone's having severe allergies, seasonal allergies, hay fever, and they're acute, that will present as double digit, like really high eosinophilic reaction. It's not going to be quite that alarming. So here are some common similar. These are literally listed. We have a form in our office that shows side-by-side comparison of allergy presentation to parasite. So parasite can contribute to asthma, especially eosinophilic asthma, allergy-induced type asthma, bloating, brain fog. How many of us have had that before? Cramps, diarrhea, that's the obvious. Fatigue. So somebody may just be generally fatigued. Flatulence, a gallbladder attack. So remember in the previous video, we talked about how, parasites can actually go up into the gallbladder. That's how they get to the liver. And they can also have liver parasites could be trying to spew out their larvae, and the body would have to get rid of that through the gallbladder so that the larvae could be pooped out, and then that's how they would spread in the wild. So gallbladder attacks can be actually caused by underlying parasites, and we've seen this many, many times with our patients. Headaches. How many people get headaches? Especially chronic low-grade headaches that might be more nocturnal. Immune deficiency. Parasites are a huge factor in just wearing your immune system out, not only because they trigger chronic immune responses, but because they're also secreting their own toxins. They're secreting and shedding their own bacteria, viruses, etc. And so they're contributing to an overload, an overstress of the immune system. Irritable bowel syndrome, mucus secretion, either upper respiratory or through the bowels. So if you notice that in your bowel movements, you're seeing a lot of mucus, that can be a sign of the secretions from parasites. Muscle problems, whether that's chronic muscle pain or actual nodules. Ulcerative colitis, so again, all the gut stuff. Weight gain or weight loss. So that's not that specific, is it? It could be either or. With a huge amount of toxic waste, patients that are susceptible to not being able to eliminate toxins well can end up with weight gain. And depending on the kind of parasite you have and how much resources they're taking, if they're feeding off you, you could end up with tremendous weight loss. So either way. Anal itching. These are other symptoms, just generally not related to allergies, but I want you to start thinking with other chronic illnesses now. So anal itching, especially nocturnal itching, this can be a sign. Some parasites like pinworm will come out and lay their eggs around the anus, which is irritating and bothersome and actually can contribute to anal itching. We see this more in children, but adults will report this when I ask them if their butt itches. They'll look at me sometimes like, how did you know? It's like a very private thing they would never mention to anybody. Appendicitis, brain abscess. We saw that on the last webinar that things can actually set up shop in the brain. Cancer. There's documentation in the literature on the association with certain cancers and certain parasites. Cardiomyopathy, dogs can get heartworm. They're on a monthly heartworm dewormer prophylactically, and humans can get parasites that can contribute to cardiomyopathy, whether they're in the heart or elsewhere in the body, causing dysregulation. Constipation, and a dry, non-productive cough. So not like a phlegmy cough or a wheezing allergy-type cough, but just like a tickle in the throat, almost just kind of random. That is a very common side effect or indicator of coughing up larvae. Remember I said that larvae can get into the bloodstream. Either you've eaten it in the food and it needs to feed off your blood, so it gets through the intestinal wall into your blood, or you get it transmitted through an insect bite. It will feed off your blood as it's growing and feeding and it's getting ready to become an adult. You'll cough it up and swallow it, and now it will reside in the intestines where it is wanting to be. The side effect of that happening is a dry, non-productive cough. And there's so many people that walk around with a dry, non-productive cough, and they may get diagnosed with asthma and may not have asthma. This is literally a side effect that I had about 15 years ago from contracting parasites in Mexico. And I had a dry, non-productive cough and got diagnosed with asthma, which I knew I didn't have. And it turned out to be parasites. So as soon as that got handled, everything cleared up. Dermatitis, any skin thing, hives, psoriasis, eczema. It has been known in the literature as far back as the early 1900s, late 1800s, to be associated with specific parasites. And that was way back then. And here we are today, and we're treating these diseases with immunosuppressing drugs, things that further suppress your immune system, and chemotherapy agents and steroids. And we probably should be deworming people. Fever, especially at night sweats, things like that. General pain, so non-specific, kind of anywhere. Hallucination. This may be something in the brain, and it may not be. It may just be simply the reaction to the toxins. Hallucination, by the way, is not that uncommon when we're killing parasites either, because we're releasing a tremendous amount of toxin from the parasites that can kind of elicit any of these symptoms, actually. Indigestion, so even upper GI tract issues, general inflammation, insomnia, night sweats, and nocturnal teeth clenching. So grinding your teeth at night, waking up with a tight jaw, sweating profusely at night. So that's different than dry, hot flashes, like with hormone imbalances. So parasites are nocturnal. A lot of them, they hide during the day. Some of them, certain roundworms, if they're in your brain or elsewhere, will come out at night. And so they wake up and party, and they've got reproductive cycles, and they're more active during certain times of the month, like during full moons. So these symptoms may kind of ebb and flow depending on the time of the day and the time of the month. So intestinal bleeding, liver dysfunction, malabsorption issues, memory loss. There is evidence, postmortem autopsy evidence, that the plaques in Alzheimer's dementia patients, if they had plaquing, the plaques themselves turn out to be biofilm that contains Lyme parasites and fungus and viruses could be coming from these other things. Nausea, peritonitis, poor coordination or balance issues, pulmonary fibrosis because of the inflammation and scarring if you've got parasites in the lungs, urogenital dysfunction, and nocturnal bedwetting. So that could also be endometriosis, fibroids. There's some evidence that fibroids could be related in some way to underlying parasites, in particular flukes. And so that could be an issue as well. In thinking with symptoms, there is, like I said, there's documentation out there. If you want to watch a really interesting presentation webinar by a researcher, Alan McDonald, if you go to YouTube and just look up Alan McDonald multiple sclerosis, he was a medical pathology researcher that was really big into researching, doing post-mortem autopsy studies on Alzheimer's dementia patients. And he found a lot of these patients had, like I said, the biofilm was containing a lot of parasites, bacteria, things like that. Well, he found that in 100% of the biopsies of diagnosed MS patients that he had received the samples of their cerebral spinal fluid was where the parasites were. They were microscopic, microfilarial, so microscopic threadworms that could have gotten in from a mosquito bite decades prior. And these microfilarial worms are moving through the cerebral spinal fluid. And he found that 100% of the postmortem autopsy patients that were diagnosed with MS, the parasites were in the cerebral spinal fluid. And he also has cited research in the veterinary world as far back as the 1940s and 50s that show that in animal husbandry and farming back then, that they observed MS-like central nervous system presentation in farm animals that had parasites in their central nervous system. And if they treated them aggressively with multiple rounds of multiple antiparasitics, they were able to actually, in these cases, if they caught it in time, reverse it. So this is a snapshot of one of the videos I grabbed from YouTube. It's Alan McDonald, medical doctor and researcher, and he's got some webinars on YouTube. I would highly recommend that you check it out. But he's pretty much convinced that multiple sclerosis is parasite infestation in the cerebral spinal fluid. Interesting. Another article in Genetic Engineering and Biotechnology News, parasite linked with Alzheimer's and Parkinson's disease, epilepsy, and cancer. And these associations were published in 2017. So this is kind of coming up as far as that goes. A lot of our patients that we see, and some of you out there watching this video, meeting me for the first time, might be aware of a condition called CIRS, C-I-R-S, which is an acronym for Chronic Inflammatory Response Syndrome or Biotoxin Illness. I'm going to talk about this more in depth in an upcoming webinar regarding parasites, but most people will associate CIRS biotoxin illness with mold exposure, water damaged buildings, and things like that. But myself and other providers like me that are addressing this with patients are also pretty convinced that parasites are a big contributing factor to these biotoxins for several reasons. One is that when you do have parasites, the environment that the parasites create leaves you more prone to yeast and fungal overgrowths. And when you have fungal overgrowths, you have mold toxins that are produced, mycotoxins. But the parasite itself is an organism, and a biotoxin is a toxin from a living thing. And nothing produces biotoxins in more volume than actual parasites. I think the parasites themselves become a contributing factor to the potential for CIRS biotoxin illness to express. And this may explain why some people go through all the steps to handle CIRS and still don't become well until they also address chronic parasites. So it is complex, not always easy for people. Huge contributing factor to autoimmunity, like we just talked about. Most of the central nervous system issues, like multiple sclerosis, Parkinson's, even ALS, are autoimmune in nature. And so is your immune system trying to attack a parasite, which sounds more sane, or is it trying to attack you? Like your immune system was not designed to attack you. In most cases with autoimmunity, the body is trying to handle something, a toxin, an invader, an infestation, and in doing so, accidentally damages tissue in whatever area it's attacking. So these are some of the questions that obviously we have. The relationship between intestinal parasites and some immune-mediated intestinal conditions. So again, this was published in 2015 in the medical journal, and basically they stated various protozoa, those are, remember, single-celled parasites, and helminths are roundworms, are connected with the main immune-mediated intestinal conditions, including celiac disease, an autoimmune disease linked to gluten, inflammatory bowel disease, irritable bowel syndrome. Celiac disease is a digestive and autoimmune disorder that can damage the small intestines and is characterized by multitude of gastrointestinal and extra GI symptoms. So inside the body, other symptoms as well. Irritable bowel disorder, including ulcerative colitis, Crohn's, is a group of inflammatory conditions of the small intestine and colon, and they have been directly and indirectly correlated and associated with parasite infestation. So it's very possible that, again, biotoxin issues related to the parasite, the impact that it's having, the disruption on the immune system, eventually leads to these hyperinflammatory conditions of the intestines. So a symptom of having parasites might be a named autoimmune disease, right? Which means you could have any kind of symptom from parasites. So the next video we will be doing will be on how we actually test for parasites. I think that you guys are realizing now that you might need some special testing, as parasites can be anywhere in the body and they may not be creating direct, obvious symptoms, and they might be contributing more to a chronic illness or disease. And so how are you going to test for that? So we'll talk about that in next video.